Good afternoon. What do the good citizens of Ohio expect of their government? They expect leadership, teamwork, cooperation, and trustful communication. They expect us to pull together to address pressing problems, and they expect us to do what is right. In the spring of 2011, House Bill 93, the bill that cracked down on illicit pain clinics and aggressively addressed the growing scourge of prescription drug abuse, passed unanimously through all committees, and then passed unanimously in both the House and Senate. And then in record time, it was presented to the governor, who signed it into law with an emergency clause. House Bill 93 shows that what the citizens expect of their government and of their elected officials can indeed be achieved. Over the last decade and a half, prescription drug abuse has become a huge problem in Ohio and in the nation. It is the root of much crime, much illness, and of many deaths that are unnecessary and therefore all the more tragic. Its tentacles can be traced to many of our social ills, including child and elder neglect and abuse, as well as hunger. It is a problem that is undermining our very state economy, and one that must be addressed fully and strongly as we struggle to put Ohioans back to full employment. House Bill 93, co-authored by David Burke, a working pharmacist, and by me, a working physician, constitutes a huge piece of public policy that has literally changed the way we look at the prescription and use of controlled substances in the state of Ohio. There was nothing timid about our approach to authoring 93. We knew the problem, and we knew how to persuade the key stakeholders to help us achieve successful passage of the bill. And from this, we are now seeing collaboration among local, state, and federal agencies on an unprecedented scale. The medical profession is working closely and well with the pharmacists to address this problem. Law enforcement is tearing down walls and working across agency lines like never before. And the problem is being viewed as it should, in a holistic fashion, something that I as an osteopathic physician particularly applaud. Initiatives are underway to attack the problem from all directions, including prevention, treatment, and recovery, while at the same time the criminals who are feeding this illicit trade are being brought to justice in record numbers. And no small thanks to our AG department. And yet, in spite of this wonderful start, much remains to be accomplished. The battle against prescription drug abuse is far from over, and it would certainly be premature to sound the victory call at this time. For what we've accomplished so far, I applaud the cooperative work of the Ohio State Medical and Pharmacy Boards, the Ohio State Medical Association and the Ohio Osteopathic Association, and the rank and file physicians and pharmacists who work hard every day and do so many good things for Ohio. I would like to thank all of my legislative colleagues on both sides of the aisle for the help in bringing this bill from a well-intended concept to a hard-hitting reality. A special thanks goes out to David Burke, who is now over in the Senate. We are so fortunate to have him here in Columbus doing good public service. Many thanks also to Danny Buck, one of our Southern legislators, who helped mentor me as a freshman legislator and put me where I needed to be for success with this bill. Thanks also to our Health and Aging Committee Chair, Lynn Watchman, who quickly saw the value of this legislation and moved huge obstacles to make it happen. And thanks to Speaker Batchelder, whose confidence in us and in our work was boundless. And here's a piece of advice for anyone wanting to get a bill passed through the House. It's a good idea to get Speaker Batchelder as a co-sponsor.
Thanks, and that was a great rendition about what happened in the past year, which was an extraordinarily busy year.